Gender affirming surgery. She has a good shape to begin with. We're going to do a little high def here, so to create some subtle lines, removal of fat to improve the waistline, and then mostly we're going to be working on adding fat to the hips for body feminization, as well as a silicone breast augmentation. All right, gender affirming surgery, low BMI, so we have limited fat. I often get asked, do I have enough fat to work with? And the answer isn't yes or no. It's more of an understanding process. So the process is we take out as much as we can, we go down to a pinch, and then we volumize and we expand based on the priority of the patient. So for this particular patient, the main question is, do we have enough for maximum expansion or maximal fill? The answer is no, there's not a lot of fat. Do we have enough fat to reach certain goals, such as expansion of the hips or filling in the hip dip? The answer is yeah. So it's case by case. It's a discussion with each patient. We're going to lipo the whole torso. We're going to primarily focus on the hips. We probably will not have enough for projection of the buttock. The patient understands and is aware and is okay with that. Feminization of the hips. Waistline contouring. So the waistline came in as much as possible. I focused most of the fat I had to expand the hips and fill in the hip dip. As you can see, there's a nice improvement. It's not dramatic or overdone, but there's a nice improvement in the waist to hip ratio from those two techniques. All right, body fem, you could see silicone breast, 485. High profiles, we got some really nice curvature. She already had a nice starting shape, so this enhanced her already nice waist to hip ratio. And you can see total case time is about 2.5 hours. Final result 3 months. Recovery is about 2 to 3 weeks to get back to work, back to the gym. Gender affirming surgery, body fem included, breast augmentation with liposuction and fat transfer to the hips and buttock. Of note, patients with a low BMI, we can still do it. We just target, we prioritize where we want to graft. So for her, her main priority was the outer thigh and hip dip area. So we improved the curves. We did a silicone breast augmentation. Final results usually 3 months, back to work, back to gym, 2 to 3 weeks. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.